Thank you for attending. Today, you'll be learning about the work your coalition can do around the National Health Observance Month of May, which is Mental Health Awareness Month. This information is coming to you from Jody Salvo of Tuscawaras County Anti-Drug Coalition and Kathy Gabe and Trish Stagger from the Wayne County Impact Group. Let's start with the history of Mental Health Awareness Month. Mental Health Awareness Month was started in May of 1949 by the Mental Health America organization and came about by presidential proclamation. Mental Health Awareness Month reaches millions of people in the U.S. through media, local events, and screenings. Its purpose is to raise awareness and educate the public about mental illnesses such as depression, schizophrenia, bipolar disorder, and it also draws attention to suicide. It educates the public about the realities of living with these conditions and treatment options available. This campaign not only raises awareness and provides education, but it also promotes strategies for attaining improved mental health and wellness. Mental Health Awareness Month strives to reduce the stigma or the negative attitudes and misconceptions that surround mental illnesses. To have a successful campaign, it is important to involve many partners and community sectors. Think about the relationships your coalition has with the community. Who can your coalition involve in your mental health awareness efforts? We recommend using a 12 sector approach to have a comprehensive reach. For example, there are community sectors that you can reach out to with this campaign, such as the education community. You can look at public, vocational, higher education, public libraries. Some of the action steps that you can look at is providing messages, signages, promoting screening tools. You can use your media sector to look at print media, TV, radio, web, social media. Use your youth from your youth-led prevention groups. You can use your parent-teacher organizations, senior citizens. There's great opportunities there to provide education and awareness through senior-centered newsletters, tabletop education opportunities at the senior centers. Utilize your medical health, your physician offices, your hospitals, your healthcare facilities, signage, education, brochures, certainly promoting screening tools. Also, your social service agencies, you can also utilize them to provide the resources to present talks within your community during this month. Use your faith-based communities. They have bulletins. They have the ability to message a lot of your communities. Think about your businesses. Can you offer lunch and learns to community businesses? Can you also provide information that they can put in newsletters that they can have at break rooms in their organizations? Utilize your county governments, your mayors, your commissioners for proclamations, for permission to hang banners and signage throughout your communities. Work with your law enforcement and also your service organizations. That's a great opportunity. They have weekly meetings, offer opportunities to come in and provide information on mental health issues. After looking at some examples of the work that can be done in your community sectors, it is then important that your coalition defines its target audience. This awareness campaign is intended to raise awareness and educate community members. Your coalition then will need to define its target audience. Each community is different, and you will know what will work best in your community. We recommend that as your coalition is planning its efforts for Mental Health Awareness Month, that you will have conversations about what will work best and be most effective in your community, and then plan your efforts accordingly. When you're working on your planning and timeline for the Mental Health Awareness Month, we would suggest laying out efforts throughout the month. There are 5 weeks in the month of May. The first week, really maybe focus in on a press release, a proclamation for Mental Health Awareness Month, promoting your online screening tools and media messages, and starting to really have a presence in your community through messaging of banners, posters, distributing information. The second week, possibly plan awareness walk or a run, maybe have an initiative to get out the Text for Hope bracelets in your community. The third week, maybe plan community education events, whether it be a town hall, but an opportunity for community members to come together to receive education and information. The fourth week, possibly meeting with your state legislators, meeting with local officials. Um, so throughout the month, just making sure that you're utilizing different opportunities to educate your community and raise awareness. It is important that your coalition is able to share a strong message and have a unified message throughout this campaign. We recommend that you have discussions with your coalition members about mental health illnesses prior to the launch of the campaign. It will be important that your coalition members are educated about mental health issues, facts, truths, and myths. That they can speak in a compassionate, non-judgmental way when talking about mental illness. That y'all are comfortable speaking in a first person on this issue. That you and your coalition members can lead the way, that you can model being comfortable talking about mental health illnesses and issues, that you all can provide engaging, um, that you can promote prevention and recommend people using screening tools that can be used to identify symptoms and warning signs early, and that everyone at your table is able to communicate that mental illness are common and treatable. It is important after you complete your campaign that you conduct a thorough evaluation. What you're going to want to do is look at the activities that you provided during the month and really look, were they successful? What could we do better? How could we change it? What didn't work so well? Is it something that we want to continue? Is it something we want to strengthen, or is it something we want to do away with? You want to track how many people participated. So an opportunity to count the numbers of people that were reached with your efforts. Um, One thing about using the Health Observances Month is these are efforts that continue to create buy-in with your coalition members. It gives you work to do on your coalition. It allows you to have a stronger presence in your community, but you probably don't have to spend a lot of money to have a successful campaign. When we looked at the efforts that we were going to be doing in our community, we thought it was pretty realistic to have a very strong campaign and use only about $2,000. Every coalition has a different funding stream or different availability to access funding. But to really sit down, how much does this cost you? How much in staff time, printing costs? What can you do with in-kind donations? So really kind of look at what this campaign will cost. Um, Next, we get to the call to action. What can you do? Assess your own mental health and learn about ways to improve personal wellness, um, ways to promote Mental Health Awareness Month, and use the screening and supports the program sites. You can attend the Mental Health Awareness Conference. This year it's called Fit for the Future. You'll learn more about personal fitness, innovative programs, model policies, practices, and policies on mental health awareness. You can create awareness that mental illnesses are common and treatable, and just be alert. Be cognizant that people around you can experience different symptoms of mental health. Um, and that they can look different. Next, we'll get to the call to action. What can your coalition do, and how can you be prepared for Mental Health Awareness Month? First, assess your mental health and learn ways to support your personal wellness and recovery through the Mental Health Awareness Screening to Supports program site. You can send a coalition member to attend the Mental Health Awareness Conference. It's called Fit for the Future for 2018 to learn more about personal fitness and innovative programming and model practices and policies. You can create awareness that mental illnesses are common and treatable, and to be alert that people experience symptoms of mental illnesses differently. For more assistance with Mental Health Awareness Month, please look at the resources and website links available. Make sure you check out mentalhealthamerica.net. There'll be a full toolkit of resources that'll be coming out mid-March of this year. Look at Ohio Mental Health and Addiction Services. They have information on the Text for Hope and the text hotline here in the state of Ohio. Look at information from SAMHSA, mentalhealth.gov, NAMI. There's just some really great information and resources. Your coalition can consider promoting the mental health first aid in your area. Contact your mental health and addiction services recovery board. Just get familiar with the resources in your community and in the state to address mental health illnesses. Thank you for attending today. I hope you find this helpful, and I hope you have a lot of success with Mental Health Awareness Month in May. Thank you for attending.